Good afternoon. We're happy to have you all here today. I am Diane Marseglia, Bucks County Commissioner. I am here with my colleagues, Commissioner Bob Harvey. Hello, Commissioner Harvey, and Commissioner Jean DiGirolamo. And we have a few other guests who have joined us today. We have Scott Forster from our Emergency Services Department. We have Dr. Damsker from our Health Department. We have Larry King, who will be reading us questions that you have all submitted from public information. And we have Jeff Fields, our Director of Housing and Community Development. And we're going to start with Jeff, and then we'll move on to Dr. Damsker and Scott Forster, and then you can ask questions to all of us as we go along. But Jeff has some important information that he needs to share as the date related to evictions and the stop on stopping evictions will be over. So Jeff, can you share this information with us?
Great, thanks, Commissioner. Yes, we've been getting questions about the upcoming end to the eviction moratorium and thought it would be a good time to talk about what Bucks County is doing to prepare and resources that are going to be available for our landlords and our residents. We certainly recognize that this is a very challenging time, both for tenants who are having difficulty paying their rent, as well as landlords who have to pay their own mortgages on the properties they own, have operating expenses related to their businesses. And we want to try to outline some of the resources that are actually available right now and that will continue to be available as the eviction moratorium does come to an end. So on May 7th, Governor Wolf signed an executive order that made an eviction moratorium that will go through July 10th of 2020. And so for most folks, no evictions will be taking place if one has not already started until July 10th. So I did think that there might be the possibility some households might not know much about the eviction process, and I wanted to just give a brief outline as to what that looks like in the event that does happen. Of course, our goal is to try to work with landlords ahead of time to prevent an eviction, but I'm going to go very briefly over how an eviction does work. And Eric, if you want to put the slide up around the housing link, I'm going to be repeating this number throughout the presentation, but I wanted everyone to be seeing this as I'm talking, because this is our local call center line to be able to get assistance. So when we're talking about an eviction, what you want to know is that generally a landlord is going to be giving some sort of notice, often around a 10-day notice before any eviction is even filed in court. Now, there are times where if you dust off your lease and take a look at it, and that's probably a good thing to do right now if you're worried about paying your rent, you might notice that notice to quit, as they call it, is waived. And in a situation like that, the landlord could potentially just go ahead and file the eviction in court. Most important thing to take away from that is that you want to be communicating with your landlord to understand both what options exist in terms of your ability to pay the rent and also what arrangements you can work out with them. If the landlord does file an eviction, you typically are going to have about 21 days, or around 3 weeks. It can be a little bit more before you would eventually have to be removed from the unit. So that's going to happen at a hearing at the Magisterial District Court, which you would get information around. And then if you can't pay rent, typically those hearings don't go in the tenant's favor. And then there's something called an order of possession, which can be filed, which is when you can actually be forcibly removed from your unit. So again, this is something we want to avoid happening for our Bucks County residents. And so the first steps you should take is to reach out to your landlord to talk about them, talk with them if you know that you're not going to be able to pay your rent, see what payment options, what flexibility they might have, what you can work out. If you do work out something, you would want to try to put it in writing so that both parties have that officially signed and written down. If you do these, the other thing is to talk to family and friends who might be able to help. A lot of times there are resources that individuals bring to bear to be able to pay their rent. But if you do those things, you talk to your landlord and you talk to family and friends and it doesn't work, we do want you to call the housing link, the number that we have up on the screen, 800-810-4434. We have staff that will complete a brief screening and then refer you to one of our Bucks County nonprofits that specializes in eviction prevention counseling and resources that can help you stay in your home. If you are going to be calling the housing link, it would be good to start collecting just some basic documentation, which would include a copy of your lease. If you have a Section 8 voucher, the award letter from the Housing Authority, a basic income documentation like your check stubs, an unemployment letter, child support letters, things like that, Social Security cards for members of the household, ID, Things like that are going to be helpful to for us to be able to move quickly to provide assistance. Also, if there is an issue that you think you need some legal representation or some legal advice, you should call Legal Aid of Southeastern PA, and that's 877-429-5994. Their hours right now for that number is between 9 and 1 p.m. Monday through Friday. So again, please call at the housing link at 1-800-810-4434. It is best if the household calls. So landlords, if you can make sure to be, if you're listening, please provide that information to any tenants that you know are behind in the rent, so that we can start working with them, and then we will be reaching out to you after we talk with the with your tenants about what arrangements we can figure out. So that's an overview of the process and the resources we have available now.
Terrific. Thank you very much, Jeff. That was very helpful, and we'll take questions for that in a minute, but I'll shift it over to Scott Forster. Would you like to share some updates with us on how things are in emergency management?
Thank you, Commissioner. So in emergency management, we continue to plan for the future as we go through this COVID event. There's no telling whether we're going to see a secondary spike or a second surge or anything of that, but it's very important that we ensure that we have enough personal protective equipment for the future, and we are building a cache that we would be able to support our healthcare facilities and our first responders with. Also, we're going to begin a after-action review process. This COVID incident is still going to go on for many more months, but this is just the beginning, so that we could take a look at what we've done in the initial response phase, as well as talk to the hospitals, the school districts, the municipalities, the first responders, and different county departments to see what our strengths were. What did we do well? And we'll also look at areas for improvement. If this virus was to come back, or we were to see another spike in numbers, we want to see what we did well. Again, this is not going to be the end of this, report. It's not going to be the end of the virus. We're still going to go on for several more months, but this is going to start to look at that initial response phase and what we did over these last 3 months, so that we can continue to be stronger and be prepared if something was to happen in the future. But like I said, we're still a long way from the end, and so we'll still be doing some more after action work over the next many months, and then we'll be looking at an improvement plan for the whole event. Thank you, Commissioner.
Thank you very much. And now we'll shift to Dr. Damsker, and if you have a brief update to give us before we take questions.
Sure. We have approximately 5,300 cases, actually closer to 5,400 cases. More than 70% of them have been recovered, and so we're trying to clear out the people that were positive over the last couple of months, and we're calling them, seeing how they're doing. And of course, the vast majority of people are doing really well. Unfortunately, we've had about 500 deaths in Bucks County throughout this. A little bit of good news is we've seen the numbers of deaths come way down. Obviously, as we've spoken about numerous times, the vast majority of deaths were in those in nursing homes. And now that we've done a really good job getting a handle on that situation, we're seeing the overall number of deaths come way down it's basically down to a trickle now. And we're hoping that by keeping everything the way we're doing it, we'll be able to keep those numbers as low as possible. I want to say we've gotten in touch with close to 97% of all cases in Bucks County. We've continued to do that, and that's a total number from the very beginning. So again, we continue to reach out to all cases so we can do our case investigation and contact tracing. Our overall numbers of cases are down still. Our 14-day case count numbers are still down, but we have hit sort of a plateau where we don't believe we'll go much lower than we have today. There's a handful of cases, whether it's 10 a day, 20 a day. Those numbers will go up and down a little bit, but we do feel like we've sort of reached a threshold because there is still virus in the community, and our main focus is to keep it from rising above those numbers and keeping our pure community spread as low as possible. And I'm sure we'll get into some questions about what's going on in other areas as the press conference moves forward. So thank you, Commissioner.
Thank you, everybody. And as we open for questions, I would just remind the public that this is a press conference, so the questions are coming from the press. We're not taking any public questions at this point. So, Larry, what's the first question?
Thanks, Commissioner. The first questions are coming from Tom Sofield of Levittown Now. The first one is for Dr. Damsker. Following the recent increase in gatherings, both those that followed the governor's guidelines and those that didn't, has the county seen any uptick in cases that are connected to those events?
If you're referring to the recent gatherings / protest gatherings, we have not seen an increase from those. Again, we are asking people when we do our contact tracing where they've been, and they are not saying that they have been to those. So we're going on people's word when it comes to that. But we have not seen a spike from those protest gatherings that occurred a couple of weeks ago.
Okay, and with our expected move to green tomorrow, what are some simple steps that people can take to keep healthy and to limit the spread of the coronavirus?
Number one is just remember that it's still there. I just got finished telling everybody that, whether we have 20 cases a day, whatever the number is, there's always a few more out there, obviously, that aren't getting tested for whatever reason. So, it's not gone. So green doesn't equal gone. I just made that up. That sounds good, right? But, I think that what's really important is that we continue to do the things we've been doing throughout yellow. The nice thing is all businesses are open now, even if they're under sort of restrictions. We can live our lives, but just do it in the back of your mind to continue the same things we've been talking about. The sanitizing, masking, all those things haven't gone away. As much as we want them to, we can see what's going on in other states that the virus is still in the community. So let's go out and do what we need to do. If you need to get your hair cut tomorrow, I'm sure they'll be busy. If you need to go to the gym tomorrow, we'll have at it. But they will be operating under new guidelines that we didn't used to have to follow. And we expect everyone to follow those and help the businesses be able to enforce those guidelines.
Okay, also from Tom Sofield, and this is a question for Jeff Fields. Has Bucks County seen an increase in homelessness so far due to COVID-19? And does the county expect one when the moratorium is lifted or when unemployment benefits are decreased?
Thanks, Larry. Yes, we've seen about a 10% increase in calls of people reporting homelessness to our call center when you compare it to the time before the similar time before the pandemic. So there has been an increase. It's not dramatic, but it is significant. We do expect that there will be continued impact as things like the unemployment benefits expire. And so we do expect to see an increase in homelessness. We also are mobilizing our system to have more resources available to respond to that need that we are expecting to see by having more agencies involved in working with the populations that might experience homelessness and more resources for helping people quickly move into housing.
Okay, thank you. We have some questions from Jeff Bowen of Lower Buck Source. For Dr. Damsker, I think you touched on this a little bit, but exploring a little bit more about the large public gatherings, do you have any thoughts about why there hasn't been a reported spike in community spread numbers from gatherings like this? Is there any explanation for why we didn't see an impact from those? I think you're muted, Dr. Damsker.
Thank you. I believe that being outside, that there's definitely a big advantage to that. To me, that also shows a little bit more that again, people have been talking about airborne versus droplet spread. This makes me feel more comfortable that it's droplet spread. Those droplets are going down. If it was airborne, like measles, chickenpox, I think we maybe have seen a few more. Not everybody was masked, but again, just being outside in general. And this goes back to even the data from China, that they had trouble finding people that were getting infected from outdoor exposures. So we really think that is probably a big reason why things haven't spiked the way they have. And I can only speak for Bucks County. I can't speak to whether other cases have been found in other areas of the country from this, but we certainly haven't heard about it if that is the case. So initial reports are good. So far, so good about those gatherings and secondary cases from those.
And also from Jeff, Dr. Damsker, do you have any one greatest concern as we move into green? Is there any one thing that you're concerned about?
And I'll get into this, more and more. It does seem to think, these seem to be that other states are starting to have a few more cases. Not all states are, but states that never had a real surge to begin with, like we had here in Bucks County, New York City, New Jersey, we had a major spike, and I think it sort of shocked everybody into realizing, hey, it's here. We have to take this seriously. And some of the other states that are having some additional cases never really had that shock, that surge. And I think that it's going to take a little bit more time for them to get used to the idea that we're already doing here in green with the masking and social distancing. So I'm hoping that those states start, and I think some of them are, like Florida is starting to, some of the counties are implementing mask required policies. And I'm hoping that other states that are seeing these surges start to take it real seriously and to avoid another total shutdown, is to start implementing some of the things that we're even doing in yellow and green that would make a big difference in those areas. So that I want to make sure that, because we have seen, and we put it out in a press release yesterday, almost a third of our cases yesterday were definitely infected elsewhere. And we know that for a fact, given our contact tracing. So there are people traveling for vacation to visit families, and they're going to places that in the past maybe did have fewer cases, but now compared to Bucks County, they have more cases. So we want people to say, hey, when you're traveling, when you're going places, hey, take into account, keep doing the same things you're doing here. If you go into a restaurant or a store somewhere else, keep your mask on, keep social distancing, keep sanitizing. Doesn't matter what state you're in, doesn't matter where you are. The coronavirus is out there. So I want people just to keep that in mind, that it's not just Bucks County that we have concerns about.
Larry.
Another question from Jeff Bowen, this one for Commissioner Harvey. Are there any recent updates or information for business owners to be aware of with regard to the Bucks Back to Work grant program?
Yeah, and I just want to real quickly touch on what Dr. Damsker said. I was at one of the vigils in Lower Makefield several weeks ago. I was at the very large march in Bristol Borough, and I was at a march in Bensalem too. And I had to say that I think in addition to all the factors that Dr. Damsker was saying in terms of why we haven't seen a lot of spread, and I think Jeff Bowen was actually at the Bristol Borough march. I saw him for a while. Almost everybody I saw at those events was masking. You saw very, very, very little physical contact in terms of handshakes or hugs or anything like that. People were being very, very conscious of the fact that the virus was around. So they were exercising, obviously, their right to free speech and talking about protesting and things that they saw that needed to be addressed. But they were doing it in a way I think that made a lot of sense. And they were conscious of their own health and the health of others. With the Back to Work grant, we did have roughly 900 businesses which have qualified for funding at some level. The first round of that, basically half of that number, those businesses have been contacted to let them know those are the businesses that really scored, if you want to call it scored sort of highest in terms of financial need, percent decrease in sales, number of employees they have, the businesses we really feel need sort of the most immediate need. They've been contacted already. Right now, what we're waiting for is they have been asked to submit some paperwork to the county. We have to document everybody we send money to in terms of for tax purposes, and so we have to make sure that we do that properly for the audit that takes place every year here with the funding that we have. And so as that information comes back in, the controller's office is working to input that. And then we're hoping to have checks out next week. We do have to vote on it as the Board of Commissioners. We have to vote on spending this money, so that'll happen on Wednesday or our next meeting. And the checks will be in the mail, and it's not just a saying. The checks will be in the mail.
Thank you, Commissioner. I guess this is a question for all three commissioners. This is from Todd Shepard with Delaware Valley Journal. Now that Philadelphia Mayor Kenney is proposing removal of the Christopher Columbus statue, what statues and monuments are under the county's control or on county property that you might be thinking about whether they should be removed or not? What are the lawful processes to have a statue or monument removed in Bucks County?
So as far as I know, we don't have any statues of any controversy or anything in Bucks County. And I honestly have to tell you, I don't know what the process is, but I know that if somebody sees one, we'll certainly be willing to talk about it and discuss it and see what needs to be done. Commissioner Harvey?
Yeah, the only monuments I'm aware of that the county has direct control of are the ones I kind of see here in Doylestown, right here at the administration building. There are monuments to World War I, World War II. World War I is actually the only one that's really a statue of two soldiers that sits sort of behind the courthouse here, though, the administration building. But there are other monuments to World War II, Korea, Vietnam, the War on Terror, the Gulf War. As Commissioner Segway said, I can't see any cause for controversy with any of those. I'm not really aware of any other statues the county has control over at other properties. Commissioner DeGirolamo?
Yeah, I'll go along with that. I mean, I've lived here my whole life, and I'm not aware under county control or under anybody else's control where there's a statute that there might be controversial in Bucks County. I don't believe there are any. Diane? Or Larry, I'm sorry.
Thank you, Commissioners. Some questions from Hayden Mittman of PBS 39. Are officials here still confident that our community is ready to enter the green phase, even though the country at large suffered its highest single-day total for cases just yesterday?
So I'll answer this first, and I don't know if everybody wants to take a turn on this one. I think we are definitely ready. I think there is a huge difference between Bucks County and the rest of the country that we're seeing on TV right now. I'm seeing a lot of people that are in those states mocking the idea of a mask. I saw people in Arizona last night on TV, making a commitment to never wear a mask. Not a good thing to do, not something that I'm seeing here in Bucks County. We are protecting ourselves and we are protecting each other, and that's what it's about. Commissioner Harvey?
No, I agree 100%. I would hope anyway that as I forget the phrase that Dr. Damsker invented on the spot about going green, but essentially we're just trying to make sure that people understand that green isn't normal. Green isn't back to life pre-COVID, back in February, January, December. The virus is still present. There are still people who, because of their age or because of their immune system being compromised, some other physical issues they may have, that are more at risk than others are. And so I think we just need to kind of be mindful of that. And I think hopefully at this point people are more comfortable with knowing how to shop and knowing how to social distance, whether they're going to a supermarket or drugstore, and they'll just kind of make those adjustments as they go to the barbershop and the gym and the mall and wherever else they're going to go.
Yeah, and just quickly, I mean, it looks like to me, if you look at the places where they're having major surges are the states that opened up too quickly, and states where masks aren't necessarily mandatory for people to wear when they go into stores. So I just think the big difference here in Bucks, and I think in a lot of ways across Pennsylvania, are that we took our time cautiously, and people were wearing masks at a pretty early stage, and we continue to wear masks. So I think we've done a pretty good job here in Bucks County and in a lot of ways across Pennsylvania. So I feel pretty confident that in us going to green, that we're in a good position. And let's remind everybody that we have Dr. Damsker on our side. So he's kind of guided this ship. And when he talks about that contact tracing and a 97% success rate, I think that has gone a long, long way to helping us manage this pandemic here in Bucks County. Larry?
Okay, and Hayden follows that up with a what if question. If the county did experience an increase in cases, how would the county have to move back to a yellow? Could the county move back to a yellow or red phase if a certain level of new cases increases following the change to green?
So I'm sure we certainly could, but I'm going to defer to Dr. Damsker just to see what would you be looking for if we needed to move back to yellow?
Yeah, and again, moving back to yellow to me is sort of not as helpful as you would imagine, unless we start seeing cases directly related to gyms, hair salons, indoor dining, the governor could always, make specific cutouts. So let's say no cases, or we haven't traced any cases to gyms or nail salons or places like that, but we do see a case jump, that we've seen coming from indoor dining or bars. He can make a specific exemption for those, but I don't think he's going to jump back into yellow per se, unless there's a reason, because that's really the only difference between yellow and green. When it goes back to red, a major stay-at-home order would only be in the case where things were totally out of control, the deaths were going up, and I think he's probably going to be a little more careful about jumping back into any other colors besides green for a long period of time. I think that the public, there's a lot of reasons, obviously, for the public, for mental health, for the businesses in general. But I think if by staying in green, by staying in this sort of heightened sense of awareness while still doing all the things that we need to do, we're hoping we can prevent cases. I'd rather go out contact tracing all day long, every day, 7 days a week, and do the extra work and maintain the green ability of our county to continue as is. I think that would be the best case. But as I've said before, we look for the pure community spread. When we start getting more and more cases of people that we have no idea where they got it from, that's when we'll start to be a little bit more concerned. But again, we'll just keep following up our contact tracing as much as possible for those household contacts, and do as much as we can from the health department's perspective. We will try our best. I know commissioners agree. We want to stay in green, hopefully forever, until the next step where we're in no colors. But again, I don't believe that'll happen for quite a while. But that's sort of how I look at it.
Okay, Samantha Bambino of the Lower Bucks Times had a question that I think you have answered about recommendations for any Bucks residents that are traveling out of state, particularly to areas where cases are rising, but you can get into that if you want. But more specifically here, she's wondering if you can discuss how we're going to monitor restaurants and businesses about how they're following social distancing and safety protocols once we go to green. She notes that a recent Facebook post by the county said something about how health inspectors will be watching, and many seem to feel offended or threatened by that.
Yeah, I think the answer is, we regulate restaurants, we regulate bars, we regulate pools, but there's certain businesses that we put an actual license on. And of those businesses, what we've seen is in other states, including Florida, Arizona, New Jersey, we've had outbreaks based on bars and large gatherings where alcohol is involved. We saw that here in Bucks County early on before we had the shutdown. So we know for a fact these are high-risk areas where things can happen if we're not careful. Look, we know the bars and restaurants have been through a lot. They've been closed for a long time. We want them to thrive. We want them to succeed. But they need to follow the rules just like the gyms do and the hair salons do. We've put specific guidance out, from the state, which we agree with, about, but no one should be served while they're standing. That's how you get real crowded people in shoulder to shoulder. We want them to have no more than groups of 4 in any bar area, separated by social distancing. And little things like that avoids these large crowds that you see. When people drink, when they start making bad decisions, even just a little bit of alcohol stops you from paying attention to your surroundings sometimes. And we feel like that's a major part of our role in public health. We happen to also license those facilities, but they're also an area where we can have a spike of cases. We can have a quick outbreak just from a few people being positive in a crowded bar. But we want them to succeed. We're going to do education. We will be sending our staff out on nights and weekends. We've had that going on long before this. We've had a night and weekend program in Bucks County, and you can ask most facilities. We have been out to most of our facilities, if not all of them, at least once or twice after hours. So this is not new, but we will be focusing on restaurants with bars as well as bars themselves to make sure that they're cooperating with those guidelines. And look, they want to remain open, right? Long term, this is in their own best interests. We talked about earlier, going back to yellow. Well, yellow is, unfortunately, bars and restaurants are one of the groups most impacted by them, by moving back to a yellow phase. So if they want to remain open and keep the outbreaks down, just follow some simple guidelines. We're not saying it's easy, and it's a little bit different from what they're used to operating with, but and we're also asking for the public, when they go to bars, please follow the guidelines that the bar or restaurant is asking you to follow. It makes it much easier for them if people aren't arguing and fighting. Please don't order when you're standing up. Just simple things like that. It'll make it a lot easier in our businesses if the citizens of Bucks County would help.
And following up on that, not just locally, this is from Jim Melward of KYW News Radio, but region-wide, do you think that enough has been done to keep things safe as things reopen? And in your opinion, what has been done that's good, and what things have we done that maybe we could do better in that regard?
Well, just overall, I mean, any business that you walk into, you pick one, right? Any business that you walk into in Bucks County, you will see signs asking people to put masks on. You'll see people wearing masks. You'll see additional sanitation stations. And again, that's something, go back to January, February, it would have looked ridiculous almost if you had seen that. And so I think we've already made some major changes here in Bucks County. And that's what other states need to start doing, is it's looking the way we're handling green is the way other states should be at a minimum handling all of their businesses. And we're hoping that that will continue when the states realize that the cases are starting to grow. You know, I don't know whether we could have learned from this. I mean, I do think that maybe they could, the opening guidance could have been a little bit different. We could have opened more things up more quickly, but I mean, it's very easy to Monday morning quarterback that. You know, I think overall, the businesses, they some of them suffered, some of them may not have even reopened, and we feel terrible for that, for them. But now I think overall, the idea that you walk anywhere you go in Bucks County, you're going to see people following, for the most part, the guidelines that the governor has set out about safety. And I think that's just a huge difference from just a few months ago. So I think we are ready. I think that I do feel good that everybody is doing their part. And even if everyone to a person isn't doing it, the majority of people are.
Okay, and also from Jim Melwert, understanding that this is a state level decision, do you have any opinions about whether Pennsylvania should consider a quarantine of travelers from certain states, similar to what New York, Connecticut, and New Jersey have announced?
Well, and I'll leave this to the commissioners if they want to comment too. Obviously it's a political decision. I would say that at the very least, anybody coming back from those states should self-monitor much more carefully. You know, that's really the answer to all of this going forward, whether it's in schools or work. You know, people not going to work sick and paying attention to how they feel. That's a big part of lowering the spread no matter where you go. And I think that people that are coming back from Florida, from Arizona, from Texas, and we've had some of those cases, you know, maybe they want to think about, you know, just taking their temperature a couple of times a day for the first week they're back. Maybe not going to visit their parents or their grandparents the first week that they're back. Just little things like that, and maybe staying away from some gatherings, maybe the first several days they're back. That way they wouldn't have to quarantine for 14 days, but just maybe take it a little bit more carefully over those first several days that they're back. You know, again, but politically, whether the governor decides to start going after people that, you know, to force them to quarantine, you know, that's really out of my hands. I'm not sure I'd recommend that, but I do think there are ways that you can get people to be more careful when they come back from those locations.
Nobody else wants to take that one. So another question from Jim Melwert. Many of the businesses that are going to reopen in the green phase employ people who work for tips, and they don't have any sick leave. Is there concern that someone with no safety net will voluntarily not stop working for 14 days if they're showing symptoms? What is your message to employers about A, making sure workers are healthy, and B, possibly supporting workers who have to stay home, especially if there's a good chance they got exposed at work?
I'll take a chance at that one first. You know, I guess this is a good time to ask employers to be patient. I think you said green doesn't mean go. So since it doesn't mean go, not all of your employees are going to be able to come in if they are ill. And you don't want them to end up making all of your other employees ill or your guests ill. And then Dr. Damsker has to say, you've got to close. So it's really important to be patient with your employees. People want to go to work. So if they're staying home and they're telling you they're ill, ask them to, you know, get a doctor's note so you can feel good. But we all have to be patient with each other. That's one of the reasons we even have Jeff with us today, is because so many people are at risk because of these things, unable to maybe make the pay that they were able to before. Commissioner Harvey and DiGirolamo, any?
Well, I think one of the things that this virus has done the past several months is it really has exposed some of the structural weaknesses in our economy. You know, the economy isn't just what the stock market's doing. when we have a lot of people in this country who weren't able to survive past just missing a paycheck or two. They're living very, very much on the edge. We're not having access, as the question gets into, not having access to family leave or vacation days or sick days. Not having that kind of not having access to childcare. I think that's going to be an issue for a lot of people. Many camps aren't opening. They can. I know that Dr. Damsker has spent a lot of time putting guidance together for summer camps to show them how they could function. But I know that some camps just, especially municipal-run camps, just aren't doing it because they just feel it's too difficult to meet all the criteria, and they're worried about how many people would send their kids to begin with. And some people aren't comfortable sending their children to camps, and so for all those reasons, you're going to have some childcare issues that people are going to have to deal with. And we are going to have to rely on employers to be cognizant of all that and work with the employees to try and help each other out through this.
Yeah, I think it's using a little common sense. I think as far as people coming in and because they need an income and coming in to work sick, I just think it's incumbent upon the employees and the employers to be able to work together and just use a little bit of common sense. If you're sick, please don't come into work. Go get tested. Hopefully the employer will help out with that part of it and, being sympathetic, but please do not come into work if you're not feeling well. I just think that's putting a lot of people's health in danger. Larry? Thanks,
Commissioner. From Chris Ullery of the Courier Times and Intelligencer, some questions for Jeff Fields. You may have already covered some of this, but are there any state level legal information resources that both tenants and landlords should be reviewing or using to prepare for the end of this moratorium?
Thanks, Larry. State resources, there are some state, I think, again, I did mention Legal Aid of Southeastern PA, which is not state per se, but they have some good information on their website, and it's a place that tenants can be calling. The Housing Alliance of PA has put out a Landlord Toolkit. So for landlords, if you just Google Housing Alliance and Landlord Toolkit, you'll be able to see that. Has some recommendations for working with tenants, as well as resources in that toolkit. PHFA.org has a variety of resources at the state level for eviction prevention, as well as information on other protections that are available. And then we did put, we have some information as well on our county COVID portal. If you go to the county's COVID portal, there's information under other information and resources. As it relates to landlords too, as I did want to mention, because we did talk about calling the housing link, and if you are a landlord watching and you're worried about tenants, again, the best thing to do is to have the tenants call. The reason being that we will typically, in addition to financial resources, we're looking at budgets and counseling and making sure that we're working with an individual household on specifically what they need. And so the bulk of the work that we're doing, we're trying to do through the tenant side, but that doesn't mean that the role you can play essentially is in making sure that your tenants have this information, to be calling the housing link and to be working with your tenants if you know that they're behind on the rent.
Okay, also from Chris Ullery, he notes what we all know, that rent can be expensive in southeastern Pennsylvania compared to other parts of the state and nationwide in some cases. So he's wondering if the county is concerned that there will be any kind of mass eviction wave when the moratorium ends, or really what expectations we have in terms of the evictions level, and what steps the county has taken or plans to take to protect residents hit hardest by housing insecurity in the pandemic.
We'll give that back over to Jeff after the commissioners have a chance to say something. But I will say that I did check the other day just to see how we were doing in case once the courts open, there was going to be a mass set of evictions, and they said no. So that doesn't mean it won't happen, but right now, we are keeping an eye on it, and there isn't like a list that's already burning and ready to go that first day. Commissioner Harvey?
I know that Jeff, I'm going to just kind of throw it to Jeff. I mean, Gene can speak if he wants to as well, but I know Jeff has been working on this and kind of prepare, and we did set some money aside through CARES that we could be able to give through different agencies that work with people who may find themselves in difficult straits in a couple of weeks. But Gene, do you want to make any comments?
I'll turn it over to Jeff. I think he's the best person to answer the question.
Thanks, Commissioners. The National Multifamily Housing Council has some good metrics looking at multifamily properties across the country. What we saw was that when we compare to April and May of 2019, there was a dip in 2 to 3% in people making their payments by the end of the month compared to April and May of 2020. Interestingly, that dip went away up until June 20th. So in the most recent statistics, we are essentially at the same exact place in terms of payments to multifamily properties nationally as we were in June of last year. So the reasons for this are not exactly clear. It's hard to predict whether there will be a mass wave of evictions, especially since eviction paperwork can't really be filed. But what we do know is that the stimulus payments, unemployment payments, some of those might have taken a while to kick in, which might have explained some of the April and May shortfalls, but it is encouraging that June is looking to be similar in numbers. So despite that, we are, I don't know whether we'd say we were expecting a wave, but we are prepared for an increase in evictions. And again, we have increased the hours of our call center, more agencies, more counselors, and more money to be able to put towards this so that we can be as prepared as possible to be supporting our landlords and our tenants.
Thank you. Also from Chris Ulrich, some questions for Dr. Damsker about enforcing mask policies. And he's wondering generally in the yellow phase and going into green, how does the health department go about any enforcement of mask policies? And to follow up on that, have county health inspectors encountered any harassment while enforcing the rules for businesses? And what has the county's response in those instances been if that has happened?
For the most part, we have not had a whole lot of problems. Not everybody wants to wear a mask for 8 hours a day. We absolutely, understand why. But, given the guidelines, they do need to wear them while the employees do. And now we're not really focusing in on the mask wearing by customers and businesses because, someone could walk in and they may have a medical reason why, or, if they call us, by the time we have a chance to get out there 4 hours later, the customer's clearly not there anymore. So we're focusing just in on complaints that if we get several from one business potentially they're not wearing masks, we make a phone call, we may do things. But remember that the masking order is difficult to enforce from a perspective. We're not licensing that facility. Now we do license grocery stores, we do license obviously restaurants, bars, and pools and other facilities. But if Kohl's, for instance, that just reopened, a couple weeks ago, if we get constant reports, we can make a phone call. But in the end, we can't shut Kohl's down based on a few employees not wearing the mask. So we try to take the route of contacting the facility, potentially talking to the manager, encourage him to focus, to follow through. And most of the time they do. And if there was a major enough thing, we would obviously get the state police involved if we needed to as well. But so far it's been okay. Most businesses are taking this really, really seriously, and we haven't had that many complaints. About employees. Yeah, we've heard people sometimes they wear their mask down a little bit, and that's going to happen, right? If you're wearing a mask for that long, there's going to be some times where people are going to pull their mask down and take a break. And we're not going to go after businesses or even give them a really hard time about that. But the businesses that say we don't want any of our staff masked, then we have a problem there potentially. But it's certainly not if someone calls us and says I was a Giant and the checkout person, her mask was pulled down over under her nose. Those are the kind of complaints that we're really unable to do a whole lot about. But certainly, if a business has decided that they're not going to mask any of their employees going forward, then we would certainly have an issue with that and move to take action.
Okay, a few follow-up questions to some of the responses from Jim Melwert. And Dr. Damsker, can you elaborate or explain what you meant when you're talking about droplets or airborne when you were referencing the large crowds?
Sure. So influenza, SARS, coronavirus 1 and 2, most bacterial diseases, meningococcal disease that you hear about, that's all going to be droplet spread, meaning that it's spread by people that are coughing or sneezing or talking, and the large respiratory droplets go out and they go down by gravity within 3 feet of your coughing or sneezing. Of course, you've seen studies showing that it can be, in larger distances, but the vast majority of those droplets spread is within 3 feet. And this goes against, we talk about the CDC guidance, being 6 feet. Obviously, it's a little bit better to be 6 feet apart. And I said this before, it's better to be six feet apart, right? I mean, between Larry, you and I, we're not going to spread anything. There's definitely a point at which you can't get spread if you're that far apart. But droplet spread is what I was talking about. This has been going back decades, this research, that droplets in general most of them tend to fall down within 3 feet of you coughing or sneezing. And now there's other diseases spread by airborne spread. And the best example is chickenpox, measles. And these are things that we have households where if you have one case of chickenpox, and people that are older remember the days when we actually had outbreaks of chickenpox in large amounts, it's very difficult to isolate. With this disease, with coronavirus, we're able to, if I know somebody in my family has coronavirus and I make a pretty good attempt to remain distance from them and make sure I wash down the handles of the doorknobs and things that we may touch in common, you can do a pretty good job and not get coronavirus from someone in your household. But when it comes to chickenpox, measles, these are true airborne. The particles are spread that way. It's almost impossible not to have really high, sometimes 90% attack rates in households, regardless of really what you do. So that was the difference between droplet spread and airborne spread of a virus or a bacteria.
Okay, and as you know, we had, I think, 8 cases yesterday in our daily report of infections that resulted from people who had traveled out of state. I think it was a little over a quarter of the total cases we reported yesterday. Can you say what state or at least what region the out-of-state cases came from yesterday?
I could say we have Florida, Texas, Arizona, and New Jersey. And that's not just yesterday, that's over the last several days. And I want to make it clear that we've had, I would say over the last week, we've started to see more and more people getting sick in other states and coming back to Bucks County. So it's not just yesterday, it's a trend that we've been seeing over the past week or so. But again, if they come back to Bucks County and they're sick, if they're not going to be spreading, if they're going out and doing what they're supposed to be doing with the masking and the social distancing and all that kind of stuff, and we'll be protecting ourselves from anyone who's coming to Bucks County, whether they're from Philly, Montco, New Jersey, Arizona, Texas, wherever they're coming from. That's why we need to keep our guard up.
And last question, also from Jim. It was just a follow-up to the hourly wage worker or tips worker at restaurants. He said he thinks that question may have been misunderstood. The question is, what do you say to someone who has a fever but relies on hourly wages or tips and doesn't get paid if they don't go to work? What can or should be done to make sure they do stay at home?
I answered it about having to do with the boss, because I figure if they're not giving the message to the employee that it's safe to stay home, I assume what they're talking about is they're going to be giving up the wage and the boss might not be willing to pay them. Their life is incredibly important. So I would encourage them to stay home. There are resources out there. The Bucks County Opportunity Council is definitely there to help. There are other food banks and other options that they can do. Their life is worth everything. So do stay home. Commissioner Harvey, you're DiGirolamo.
Okay. Commissioner, I think that's all the questions we have today. So if you had any closing statements, I'll turn it back to you.
Okay, go backwards here. Jean, did you want any closing statements?
And again, we're the county's going the green. I think we're in a good position to move the green very safely and very securely. And the message I'm just going to leave everybody with is, continue to do the things you're doing. And I really believe that wearing masks is so important for everybody to continue to do. And to remind everybody that you're not only affording yourself some protection, but you're protecting the people around you, whether it be your family, your friends, co-workers, or whoever they are. please continue to wear masks, even though we're in the green phase. Bob?
No, I'll echo that and thank everybody for their continued work. I mean, we're obviously transitioning here in terms of what we're looking at. There was a time when most of the questions or every other question was directed towards Scott Forrester. And this is, I think, maybe the second one of these we've done where we really hasn't had a lot focused on him as much. Don't misunderstand that. There's still a lot of work that needs to be done by emergency services, and they continue to work and, get everything ready for, God forbid, a second wave of this. And now we're really kind of looking almost at a little bit of recovery, but we do need people, to kind of keep conscious of everything, take the precautions you need to take for yourself, for family, for friends, and for other people around you. The Economic Recovery Task Force was worried about sort of a second wave and people getting too complacent. They did ask for sort of almost like a marketing campaign to remind people to mask up. We actually have a sign that we're going to be putting out to people. I don't know if it's available to be shared real quickly so people can see it. If not, that's all right. But there was an artist who, here it comes. There's an artist named Tom Rudisile who donated this mask idea, or this poster idea, Mask Up Bucks, Stop the Spread and Save Lives. This is going to be made available to people to print out through the COVID website here, the economic resources we're going to be using here on county office buildings, and we'll be able to get it out to any businesses that want to use this and get this message out that we're still masking. We're still trying to be safe and cautious. So just keep that in mind, and we'll stay safe, especially with the holiday coming up next week or the next weekend. Just be very conscious of that when you're gathering together with family and friends, that we're not out of the woods yet. So thank you.
Thanks, everybody. And that's a good point, that next week's the holiday. And I know people sometimes think when they're with their families, like, you don't have to worry, you're not going to catch it. But I think Dr. Damsker has been pretty clear with us that that's where he's seeing a lot of the spread now, is within a family. So leave a little space there and still use masks. But the last thing I wanted to say as we go to green is a thank you to Dr. Damsker. You have become Bucks County's, everybody's doctor here. And I appreciate that you have gotten us through here, and you got us through here even though green doesn't mean go. So thank you very much. Thank you for all your work. And thank everybody on here for being here today. Take care.